Hello, all. Now we'll be discussing nutrition through the life cycle. We know that throughout our life, from conception to death, the nutritional needs keep changing. And there are different principles that need to be adopted at each stage of life. So the human body constantly develops and changes throughout the human life cycle, and food provides the fuel for all those changes. The major stages of the human life cycle include pregnancy, that is the conception, that is life inside the womb of the mother, infancy, when the child comes out, the first year of life, then the toddler years, childhood, puberty, older adolescence, adulthood, middle age, and the senior years or old age. Proper nutrition and exercise ensures health and wellness at each stage of human life cycle. So now let's discuss the most the first stage of life, that is diet during pregnancy. So the contents we will be discussing will be physiological changes during pregnancy, the nutritional requirements, complications in pregnancy like gestational diabetes, toxemia of pregnancy, and also of effect of maternal malnutrition on the fetus. So a whole new life begins at conception. When the egg and the sperm, or the ovum and the sperm fuses together, there is something called as a zygote. A new life begins. Organ systems, and after that, the cells keep multiplying at a very rapid pace. The organ systems develop rapidly, and nutrition plays many roles. Pregnancy from conception to the birth usually lasts 40 weeks. That is like 10 lunar months or 10 menstrual cycles in humans. During this period, the unborn child grows from a single cell to an infant that is actually ready for life outside the womb. So lot of changes takes place in the mother and the baby, and especially the mother, like during pregnancy, obviously the mother has to eat to support her child, to regulate her metabolism, prepare for labor, birth, lactation, etc. So pregnancy calls for a lot of attention from the part of the mother, because a lot of changes occur during pregnancy. There is the hormonal changes, everything changes. Cardiovascular, the blood volume increases, plasma volume increases, cardiac output increases, the blood pressure goes down, vasodilation happens, there is a possibility of varicose veins. So the uterus actually expands from 100 grams to 1.1 kg. That is like about, it's like 10 times, right? So there is a lot of differences. There is increase in cervical discharge. The vagina, there are changes in the vagina, the cervical region, in the bloodstream. RBC production increases, WBC, platelets, hematocrit decreases, floating factors increases. There is a decrease in albumin, ALP. There is an increase in the placental proteins. Then the skin, there are different changes, like there are dark there will be linea nigra, which is like a dark line that comes up. Some people might have dark pigmentations. So many things can change. So respiratory tidal volume increases, respiratory rate increases. There are a lot of changes in the hormones, etc. So lot of changes happen in pregnancy. Changes in estrogen and progesterone is one of the most important changes. There is, woman will produce more estrogen during one pregnancy than throughout her entire life when not pregnant. So during pregnancy, estrogen promotes maternal blood flow within the uterus and the placenta. Blood volume increases. The measured volume increases gradually by 30 to 50% in the pregnant woman, and by the time she is like fully pregnant, she has about 1.5 liters more blood than before pregnancy. A higher circulating blood volume is required to provide extra blood flow through the placenta so that the nutrients and oxygen can be delivered to the fetus. The increase in blood volume is caused by two changes. that is increase in the volume of blood plasma and increase in the number of RBCs in the circulation. Now, what about blood pressure in pregnancy? Now, progesterone will cause the ligaments and joints to loosen during pregnancy. It will act, it will act with some other natural chemicals in the body to cause the muscular walls to relax. So that results in less resistance to the flow of blood. So naturally, the pressure goes down. And the same volume of blood is circulating in slightly wider blood vessels, the blood pressure goes down. So low blood pressure is particularly common in early pregnancy. Many women, sometimes feel dizzy, especially in the first trimester. It could be because of less blood and less oxygen being pumped to the brain. Progesterone can also cause a sudden large relaxation in the blood vessels, resulting in feeling of dizziness or even a brief loss of consciousness. Now this happens usually in the first weeks of pregnancy. In movies and all, you must have seen like one woman just fainting and coming to know that, oh, I'm pregnant. Like this is like a very common scene that we see in movies. Like in the first initial stages of pregnancy, there is a chance for passing out or feeling dizzy, etc. So that is because of a lower blood pressure. Now coming to respiratory changes, during pregnancy, the amount of air moved in and out of the lungs increases by nearly 50%, because each breath contains larger volume of air. The rate of breathing increases slightly, breaths per minute increases. Many women find they get short of breath, like they can't breathe deeply as usual. The baby, because after, especially as the baby grows inside the womb, it crowds the mother's lungs. The baby, the womb, the tummy becomes large, and it starts congesting the rest of the body, right? So the lungs and all get congested, and so the mother finds it difficult to breathe. But if a woman is weak and tired, or she's short of breath all of the time, she should be checked for signs of sickness. So it can't be always a normal signs. Then there are chances for heart problems like anemia, poor diet, etc. Those reasons can also be contributing to these especially breathlessness. Now, what about the gastrointestinal system? During pregnancy, the muscles in the walls of the GI tract will be relaxed slightly, and the rate at which the food is squeezed out of the stomach and along the intestines is slowed down. So there are chances that the women, they get constipated. The pregnant women usually feel constipated because of the fact that the GI tract transit time, it is slow than usual. Many women also have nausea in the first months of pregnancy, a burning feeling, burning in the stomach or between the breasts. It's mostly because of indigestion, sometimes heartburn. Because even though it's called as heartburn, heart is not involved. It is because of your gastrointestinal. You might feel a very sour taste in your mouth. As the pregnancy progresses, the growing baby starts to crowd the mother's stomach, pushes it higher than usual. So the acids in the stomach that help the digestion of food, it gets pushed up, and that causes this feeling, that sour taste in the mouth. So a lot of changes happen in the changes we have discussed, like in the cardiovascular system, the respiratory system, the hormonal system, and also the gastrointestinal system. Then of course there are changes in the breast. In early pregnancy, the breast may feel very full. They may increase in size as pregnancy progresses. The areola around the nipple, that is a circle of the pigmented skin, they become dark, and the diameter also increases. Surface blood vessels may become visible, and sometimes they might have a bluish tint, because the veins and all might be visible. By the 16th week, that is during the second trimester, the breast begin to produce the colostrum. They start producing the colostrum, which is the precursor of breast milk. It is a yellowish secretion from the nipples, which thickens as the pregnancy progresses. It is extremely high in protein and contains a lot of antibodies, and that help to protect the newborn baby from infection. Now, what are the changes in the urinary system? Now, the kidneys extract waste from the blood and turn it into urine, right?
So they must work extra hard to filter the mother's own waste products plus that of the fetus. So the kidney is actually doing some double work here. And therefore, there is increase in the amount of urine produced during pregnancy because there is need to urinate more often, especially in the first trimester and the last months of pregnancy, especially during the labor time and all. The mother feels like extremely all the time she might want to pee. So this happens because, the growing uterus is pressing against the urinary bladder. So in late pregnancy, a woman has to get up during the night to urinate because the fluid retained in the legs and feet during the day is absorbed into the blood, and when the legs are raised in the bed. So the kidneys extract the excess fluid and turn it into urine. So the bladder fills very quickly at night. So there are chances that the pregnant mothers, especially during the late pregnancy, has to get up multiple times during at night and all to pee. Then there are changes in the skin, as mentioned earlier. Linea nigra is a dark line that appear between the belly button and the symphysis pubis or the pubic region. And in some pregnant women, it can extend up also. That is the bone between the breasts. So up almost, it's a small, it's a very thin black line. It is a hormone-induced excess production of brown material pigment in the skin cell areas. Okay. Then there is something called as chloasma. There is a brown pigmentation of the skin over the face and the forehead, known as the mask of pregnancy or chloasma. Just make note of these terms. Linea nigra is the dark line, and chloasma is the mask of pregnancy, which is a brown pigmentation. Okay, it gives a bronze look. It begins about 16th or the second trimester of pregnancy, and it gradually increases and usually fades after delivery. Then, of course, there are stretch marks come, as the weight increases over the breast and the areas, the abdomen, thighs, etc. Then the activity of the sweat glands also increases. The women kind of sweats more profusely than usual. Especially the women might feel very hot during pregnancy. There is chances of hot flushes, especially during the second trimester, and all. The woman, the pregnant woman feels very hot. So sweat glands are also very active during this time. Then let's come to, so these are the normal changes that happen during pregnancy. There are a lot of changes happening in the body, the blood, blood related changes, hormone related changes, etc. And then comes the complications or the abnormalities of pregnancy. So most pregnancies occur without any complications. However, some women who are pregnant can experience complications that can involve their health and their baby's health, and both. So sometimes diseases or conditions the mother had before she became pregnant can lead to these complications. Like we'll be discussing some of the complications like high blood pressure, gestational diabetes, preeclampsia, preterm birth, then loss of pregnancy or miscarriage. These are the most common complications. So what are the factors that increase the risk of complications? First is, when you're older, like about being pregnant at age 35 or older, there is chances of these complications being high than being pregnant at a very young age, like 16, 17, 18, etc. Then having an eating disorder, having a very low weight, then smoking, using drugs, drinking alcohol, having a history of pregnancy loss or preterm birth, carrying multiples such as twins, triplets, there are chances of these complications, etc. And also having diseases which before pregnancy itself. So that such things can increase the risk of complications. So first complication is high blood pressure. High blood pressure occurs when the arteries that carry blood from the heart to the organs are narrowed. So it is associated with other risks, other complications like preeclampsia also. High blood pressure, especially mothers of having high BP, they have a tendency to have a preterm birth. The baby might be well before the due date itself. This is preterm delivery is quite common in people having high blood pressure, and mostly it will be C-section deliveries because doctors might not want to take risks. So it also increases babies being very small because naturally they might be operated at 8 months or 7 months. So it is very important to control the blood pressure with medications during pregnancy. Then comes another complication, that is obesity. This is usually associated with the risk for
gestational diabetes. So if the mother before her pregnancy she's overweight, like she's obese, then there are chances for gestational diabetes, hypertension, mortality, and the need for induced labor or C-section. So lower weight gains are acceptable for overweight women because naturally the fetus can receive a part of the energy requirements from the maternal stores. So even if the mother does not eat much during pregnancy, if she's obese, there are a lot of maternal stores, so that the calories for the baby can be obtained from them. So they just need to gain 6 to 7 kg during pregnancy, while the normal women need to they can gain weight up to 15 kg, 12 to 15 kg. So each obese pregnant woman should receive individual assessment and nutritional counseling at the beginning and throughout the course of pregnancy, because weight management should be a very good priority. Next, very common complication nowadays is gestational diabetes. During pregnancy, when a woman has diabetes, it's called as gestational diabetes. So this is very common nowadays. Diabetes developed during pregnancy. Studies have clearly shown that patient education, intensive management for glycemic control can help the mother to have a healthy pregnancy and a healthy baby. So this is something which is very common nowadays. A lot of people have this problem, and most commonly the associated problem with this is the baby might be overweight. A gestational diabetic mother might deliver overweight baby, and also there is a chance that the mother after her delivery she might develop diabetes later on in life. So it is very important that the mother monitors her blood glucose levels and have a tight control on the blood glucose levels. Next is preeclampsia, which is also called as toxemia. It occurs after the first 20 weeks of pregnancy. It is associated with high blood pressure and possible problems with your kidney. The kidney problems along with high blood pressure is called as preeclampsia. So the recommended treatment for preeclampsia is delivery of the baby and placenta to prevent the disease from progressing. So the doctor will discuss the risks and benefits regarding the timing of delivery. So before the time is before the due date itself, the doctor might want to induce a delivery or do a C-section. Next complication is anemia. It is lower than normal, red blood cells in the body. Anemia is quite common in pregnancy. First of all, the blood volume increases. The blood is very dilute. That is, the volume increases, but the red blood cells are low. Okay. So what happens is in the pregnant women, they feel very tired, weak. They might, and if they are having less than normal blood cells, what happens is they might have pale skin, they can faint, and they might have a lot of other complications. So anemia can have a lot of causes. So it could be due to iron deficiency, it could be due to folic acid deficiency, it could be due to any other B12 deficiency, etc. So the most common treatment, or the way it can be handled, is taking supplements of iron and folic acid during pregnancy. It is very commonly prescribed, even if the mother is not anemic. Also, a lot of doctors prescribe iron and folic acid tablets during pregnancy, because it's very important for maintenance, and it's difficult to get the folic acid. You don't meet the RDA usually with the common diet, so that is why doctors often prescribe iron and folic acid supplements during pregnancy. Then comes preterm labor. That is when the labor occurs before 37 weeks. That is called as preterm. That is before your previous organs such as lungs and brain have finished developing. So certain medications can stop labor, and doctors usually recommend a bed rest to keep the baby from being born too early. So these are then the last one is miscarriage, that is loss of pregnancy during the first 20 weeks. According to the APA, or the American Pregnancy Association, up to 20% of the pregnancies among healthy women actually end in miscarriage. Sometimes this happens even before the woman is aware that she's pregnant. Miscarriages are not preventable, a loss of pregnancy after 20 week of pregnancy, that is called as a stillbirth. That is, the baby has already developed into a baby. So that is what, like, after 20 weeks, the baby will have recognizable features, like the organs, the head, everything is differentiated and the organs are well developed. That is why it looks like a unborn baby. So that is what it is called as a stillbirth. And before 20 weeks, it's called miscarriage. So many times the cause is unknown. It could be different causes, like problems with placenta, chronic health issues in the mother, any infectious diseases, like, any viral infections. All those things can cause miscarriages. Then let's come to the nutritional requirements during pregnancy. So pregnant women have unique nutritional requirements. That is why they have a different space in the RDA table when you're discussing the recommended dietary allowances of all the of the population. There is a different category for pregnant women, right? So this is because they need additional calories, they need additional nutrient requirements. So there is an additional 350 kilocalories per day when compared with non-pregnant women. And for breastfeeding women, it's different. We'll be discussing when we be discussing lactation. So there is different, like all those different nutrients will have different set of requirements. First, we'll be coming to energy. It is 300 to 350 kilocalories. It's for growth, physical activity of the fetus, growth of the placenta, increase in the maternal body size, additional work which is involved in carrying the weight of the fetus, extra maternal tissues, increase in the BMR. So all those things can leads to increase in energy consumption. So during the first trimester, you don't need to eat that much because you don't gain much weight. It is during the second and the third trimesters you need to increase the amount of calories that you take. And it is also different for a sedentary worker, a moderate worker, and a heavy worker. So somebody who is completely at bed rest, who's not doing any work, don't need to take as much calories as somebody who is involved in labor. I mean, labor in the sense who's doing some work. So first trimester, it is 10 kilocalorie per day should be increased. In the second trimester, and 90 kilocalorie per day should be increased. And in the third trimester, it's about 200 kilocalories per day should be increased. So total of 300 kilocalories per day. That is why in the whole lot, it's told as 300 kilocalories. Then comes protein. Normal protein requirement is about 50 grams per day. An additional of 15 grams for pregnant women is recommended because it is essential for the rapid growth of the fetus. Naturally, we know that protein is for growth, enlargement of uterus, mammary glands, placenta, all these things, all the growth development means, of course, protein is a body building food, right? So for growth of anything, you need proteins. So increase in the blood volume, so blood cells, all those needs are protein. So increase in plasma, increase in the blood pressure, the osmotic pressure, then circulation of tissue fluids, all these things require protein. Then the formation of amniotic fluid, transfer of amino acids from the mother to fetus up to 20 weeks. So all the amino acids must be provided to the fetus because for all that, proteins are required. So an additional 15 grams protein is required compared to a normal woman. So when protein requirements are not met, what happens is there is risk of pregnancy. The fetus may not grow. It grows at the expense of the mother. Means the mother, the fetus will grow, but what happens is the mother will suffer. So what happens, like the mother's energy will be lost, the mother's, the bones, everything, like all the tissues will be wasted. So what happens is it grows at the expense of the mother. So maximum growth of the baby cannot be obtained. Number of cells in the tissues, especially in the brain, may not be normal. So the brain development and all may not be proper. Then milk, meat, all those things should be obtained, and the good quality, good biological value protein should be provided in the diet of a mother. Coming to fats, it's 30 grams per day. Calcium, it's about, the requirements increases during pregnancy to 1000 mg per day, especially for, calcification of the fetal bones, teeth, protection of calcium depletion from mother. Here also, it's very important that the mother takes a calcium. Usually supplements are given because of the fact that, if the baby is not getting enough calcium, the baby just, supplies, takes it from the bones of the mother. So there is risk of osteoporosis, that is the bones become really porous. So the baby gets it, but the mother suffers. So that is why enough amount of calcium and proteins and everything should be taken by the mother. Then coming to iron, the normal iron requirement is usually 30, and the iron during pregnancy is increased. This is because of hemoglobin levels. Infants are generally born with a hemoglobin level of 18 to 22 gram per 100 ml of blood. That is, it's higher than the adult, because when you can see the newborn baby, it will be red in color if their hemoglobin levels are very high. And they are born with actually the iron stores for up to 6 months. This is because, the breast, like say for first 6 months of life, the baby is being exclusively breastfed, right? So at that time, breast milk does not contain iron. So the baby already has iron stores for the first 6 months. So after 6 months, when the baby is not getting, the stores are depleted, you need to increase. That is why when you're going to increase, when you're going to add other foods to the baby's diet, you need to take iron rich foods also for the baby. So iron is also required for growth of placenta, growth of the fetus as such, fetal blood. Then, so for all this, the mother actually transfers 240 mg of iron to the fetus during the entire gestation period. So iron is also required for the formation of hemoglobin, as there is a 40 to 50% in the increase in maternal blood volume. So for this also 400 mg of iron is required. Then there is loss of maternal iron through skin, sweat. So that is like about 170. So to compensate for that also, you need iron. So total iron requirement for the entire period of pregnancy is about 810 mg, including the blood loss at the time of delivery. That is when the woman goes into labor, there is a lot of blood loss, right? So all those things should be considered, and that is why iron, usually iron and folic acid supplements are given. And you can also take a lot of iron rich foods like organ meat like liver, then dried beans, dried fruits, green leafy vegetables, eggs, iron enriched cereals, iron fortified salt. All those things can give iron. Then sodium, there is a increase in extracellular fluid. So this also calls for increase in sodium. Then the blood level drops, kidney produces the hormone renin. As a result, there is a chances that, there is retention of sodium like edema, especially in the legs and all. So adequate amounts of sodium should be taken. Then iodine, there is additional requirement of 25 micrograms of iodine per day during pregnancy, because iodine is required for, it is very much required during pregnancy, because otherwise if it is that normal requirement of 100 to 200 microgram is not met, there is a chance for abortion, stillbirth, congenital anomalies, etc. And also cretinism, the baby might not have enough brain development, psychomotor defects can be there. So iodine should also be there in the baby. So iodine is very important during pregnancy. Can the baby, the woman can take fishes, then iodized salt, etc. should be taken. So these are the different recommended dietary intakes during pregnancy. Each of those, iron, the other micro minerals like vitamin A, beta carotene, thiamine, riboflavin, nicotinic acid, or niacin, pyridoxine, ascorbic acid, or vitamin C, folic acid, vitamin B12. All these things, there is an increase in pregnancy. Some of them will have an increase, some will be the same as a normal person. You can see the differences between the normal person and a pregnant woman. But usually the vitamin C and all levels are the same. There is not much of a difference, but you can see folic acid and all, there is a 4 times increase. There is no change much in vitamin B12 and all. But most of the others, the vitamins and all, there is changes. That is, there is increased need in pregnancy. So folic acid, we know that it is very important because to prevent macrocytic anemia of pregnancy. It is also needed for a synthesis of essential components of DNA and RNA, which is very important during growth. So it is also needed for maturation of RBCs. So a folic acid is like a very, it is a prerequisite for pregnancy. So even if the woman is planning for pregnancy, they should be taking folic acid supplements. That is what is the current recommendation. So folic acid is very, very important for pregnancy. So dietary guidelines, the normal dietary guidelines that have to be followed during pregnancy are small and frequent meals should be taken, because the pregnant woman might find it very difficult to digest really bulky meals. Then there should not be any cut like missing meals or fasting. Then more fiber should be included because there is a chance for constipation. 5 to 6 servings of fruits and vegetables can be added. The diet should be rich in calcium to prevent osteomalacia. Calcium supplements can also be taken. Iron-rich foods should be taken to prevent anemia. And of course, iron, diet should also contain optimum amounts of sodium. If there is edema or hypertension, then there is you need to restrict sodium. Hypertension means like if you have a BP problem, naturally you need to cut down your sodium levels. Then you should take a lot of green leafy vegetables so that you get all the minerals, vitamins, etc. Plenty of water should be taken so that the bowel movements are good. Then don't add too much of fatty foods, fried foods, excess seasonings, strongly flavored vegetables, because there is chances for gastrointestinal disturbances, nausea, etc. Then fluid intake should be between meals rather than along with meals. Then adequate amount of calories should be taken so that enough fat is deposited during pregnancy, which can be utilized for lactation. So pregnancy is a time which is like a preparation for lactation also. That is, the mother is supposed to be going to feed after birth, right? So pregnancy time, you should eat enough so that there is enough store because during labor you lose a lot of blood. You're going to lose, like in the first initial time, after birth there is a lot of difficulty, so the mother can't be eating and all. So you need to have enough stores so that your lactation is smooth. Lot of lifestyle changes also can be adopted. If somebody is like smoking, you should completely quit it. Even alcohol, then you can avoid all those sugary drinks, like all your Coca-Cola and all those aerated drinks. Then excessive eating, all the junk foods. Then eating, you don't need to eat for 2 people. That's just a common misconception. You don't have to overeat. You should eat good quality foods. You need to have a good, increased calorie intake, but you don't need to eat in excess, because you don't need to gain more than 12 to 15 kgs. More than 15 kg if you are gaining, that means you will face trouble. So that is what is normal. Then caffeinated beverages should be in moderation, because there is high chances of higher risk of miscarriage if you take a lot of coffee, etc. You can go for decaffeinated drinks, etc. Then then there is a when you're eating fishes, like which contains mercury and all, shark, because they contain like mercury, they should be avoided. Then fatty fishes can be considered. Omega-3 capsules can be taken. Then focus on protein-rich foods. And then, of course, you should stay away from all those weight loss plans, diet plans, and everything, because you're not going to go for any low-carb plans during pregnancy. Don't go to any, dieting, any something which tells you that, you will not be fat during pregnancy or something like that. Don't listen to any advice of such people. You need to gain weight, you need to have healthy calories, etc. You need to take your carbs, you need to take your proteins, you need to take all your essential nutrients. So don't stay away from all those crashed diets, etc. And of course, you should ensure high standard of hygiene. All those, foods which are like stale or anything, you should not eat any old foods, etc. You should not be eating from outside should also be restricted. Then you can go for your favorite junk foods for special occasions, etc., but don't get accustomed to it. Then increase your calcium intake. Calcium is essential for the baby, especially in the last 2 trimesters, when the baby's bones, teeth are developing, like bones, all those areas are developing. So those 8 times you need to take a lot of calcium. So these are the different foods, and how it impacts, the deficiency can impact the baby and the mother. Like if energy and protein are less, or there is deficiency, there is chances for abortion, complications during delivery, ketosis, enough not enough weight gain, pregnancy induced hypertension can be there. Then if you're not taking enough calcium, there are chances for muscle cramps, osteomalacia, then decreased breast milk. Then in the case of baby, the calcification of bones and teeth might be decreased, the baby might be underweight. So all those problems can happen if there is the deficiency of these nutrients. So you can go through them. I'll be giving it in the notes very in detail. So what are the different, what is a balanced diet for a pregnant woman? Cereals usually should be 300 grams. Fats, you can take about 30 grams. Sugars like 20 grams. Milk, curd, etc. About half a liter every day. Pulses, nuts, 60 grams. Fruits and vegetables, like fruits, you can take 200 grams. Vegetables, 350. Green leafy vegetables about 150 grams, other vegetables 120 grams, roots and tubers you can go for 100 grams. So this is usually for a vegetarian diet. That is why the vegetables are all given as sections. But if it is a non-vegetarian diet, it could be a little more different. You can skip out the like roots and tubers and all that. Pulses and all can be decreased, and instead you can have your fish, chicken, etc. So this is just a normal sample diet. You can just check it out. I'll be sharing the slides. Okay, these are the different points that are be taken for the first stage of our life cycle. That is, when the baby is still in the womb, the mother has to take the food, and that is for a pregnant woman what needs to be taken care of. So that is the first stage of our life cycle, the diet for a pregnant woman. Hope it is clear.